Okay, hi, my name is May. I'm going to be your student nurse today. I'm going to be performing a head-to-toe assessment. Before we begin, I'm going to go ahead and wash my hands. While I'm doing that, could you go ahead and state your name?
Mark Villa.
Can you tell me what day it is?
It is Sunday, August 9th.
Okay, and then could you tell me where you are?
In my house.
Okay, great. Could you tell me why you're here today?
So you can do this assessment.
Okay, great. So it appears that you looked well-groomed and you look pretty kept, and you seem to have a good sense of memory, attention span, and speech pattern. Okay, so first I'm gonna go ahead and I'm gonna go ahead and assess your head and your nose and your throat, starting with your head. So I'm gonna go ahead and feel your head if that's okay with you.
Yeah.
Okay. So you don't seem to have any bruises or bumps. Anything hurt?
No.
Okay, I'm going to go ahead and palpate your lymph nodes. I'm going to start back here. And I don't sense any inflammation here. So preocular, I'm going to go right over here, postocular, and down here again, and I don't feel any inflammation. That's great. Okay, now I'm going to go ahead and test for your eyes. So do you mind removing your glasses and look straight at me? You appear to have one lazy eye. Go ahead and look back at me. Okay, and your corneal reflection is good. It's in the same area, so I'm not worried about that. Great. Please keep your glasses off. And I'm going to go ahead and I'm going to check your eyes for perla. And so first, I'm going to make sure that your pupils are equal. They appear to be equal. Great. And they're round and they respond to light. They constrict both. That's great. And they both accommodate for one another. So I'm going to go ahead and can you take a look at this light? Well, look at this. Great. Okay. I'm going to have you focus on this light, okay? Okay, and both of your pupils constrict properly. That's good. Now I'm going to have you follow my pen light, okay? Just your eyes and not your head, okay? Great. Your ocular movement is great as well. Now I'm going to go ahead and do peripheral tests. So what I want you to do is I'm going to wave my fingers. Tell me when you can see my fingers, okay?
Boom. 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 Boom.
Look straight at me while I do this.
Boom. Boom. Boom.
Okay, great.
Boom.
Okay, great. Okay, now I'm going to go ahead and check for your ears. Let me know when you hear something.
I hear something. I hear that.
Okay, great. So your ears seem to be fine. I'm going to go ahead and inspect your mouth. Please open your mouth for me. You seem to have good teeth. Can you open up a little wider? Okay, great. And your gums seem fine, and you don't seem to have any lesions of any sort in there. Okay, now I'm going to go ahead and check your gag reflex. Could you go ahead and swallow for me? Go ahead and swallow. There you go. Great. Gag reflex seems to be working well. And can I have you say ah? And stick your tongue out? Perfect. Okay, now I'm going to go ahead and observe your facial symmetry. Can you smile for me? Frown. 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 Can you puff up your cheeks? Okay. And wrinkle your forehead. Okay. I'm going to have you bite down for me. Bite down. Bite down. Okay, that's what I need you to do. Great. Okay. So now I'm going to go ahead and check your neck to make sure your trachea, look for me please, is in midline. Wonderful. Doesn't seem to be any problem there. Already palpated your thyroids for any masses. And I'm going to have you do a shoulder shrug for me. Okay. And do your shoulder shrug one more time. Okay, great. And then I'm going to have you do this for me. Okay. Good, good. Now can you grip my fingers for me, please? Yeah, go ahead. Grip. Stronger? Okay, great. And then I'm also going to see if you can feel this just fine.
Mm-hmm.
Yeah.
I feel it.
Okay, great. And 1 second, I'm going to use a pen. I'm going to have you tell me which part is the dull side and which one. Close your eyes for me. Is this dull or sharp?
It's dull.
Okay. And this would be?
Sharp.
Okay.
Dull. Sharp. Dull. Sharp.
Speak up, please.
Dull. Sharp. Dull. Sharp.
Okay, great. And then I'm going to go ahead and check for your lungs now. But before I do that, I'm going to go ahead and check your spine. So could you just bend over for me? Yes, that's fine. Doesn't appear that you have any scoliosis, so that's great. I'm going to check the anterior part of your lungs. When I ask you to breathe in, please do so. Deep breath. Okay, you can let go. You don't have to hold your breath. Breathe in. Okay, good. You don't have to hold your breath for any of these. I'm going to take the posterior area. Turn around for me. Okay. Go ahead and take a deep breath. And last one. Okay, great. Turn right around for me. And I don't have a reflex camera, but go ahead and relax these for me. And I'm going to have you go into this position. Just like this. Straight, strong. There you go. Relax this knee. Relax, relax both your knees. Can you lift your chair up?
I can desire.
Oh, there it goes. Wonderful. Now I'm going to go, you can go ahead and relax those arms. And now I'm going to go ahead and listen to your heart sounds. You don't have to hold it anything for me. Okay. So I'm going to start with your aortic, your pulmonic, your tricuspid, and your apical pulse. Very strong heartbeat. That's good. I'm going to go ahead and test for your, I'm going to listen for your bruise. So go ahead. Okay. And now I'm going to go ahead and check your skin. So can you just hold your skin out, your arms out for me? Okay, you have good skin turgor. That's good. I'm going to have you over here. I'm going to check your radial pulse. Okay, it's about 64 beats per minute, which is good. And then I'm going to go ahead and check your capillary refill. So kind of have you spread out your hands for me. Let's check this finger. Okay, good capillary refill. I noticed that you have a little bit of a bruising on this finger, so I'm going to leave that one alone. Your pulse is good and strong, and it's about 2, which is within good range. It's not bounding, nor is it absent. I'm going to go ahead and check for edema. No sign of edema, that's good. No inflammation, wonderful. And I'm going to go check for Homan sign. So what I'm going to have you do is, if we had a position to do so, I would lay you supine. And for the sake of assessment, he's supine, and I'm going to have you lift your legs. And I would have him go ahead and dorsal flex this back. Oh, go ahead. Flex backwards. There you go. And if you had any pain here, that'd be an indication of such, but you don't have any. I'm going to inspect for hernias here. Lay down. Back. Inspect for any hernias. It doesn't seem that you have any. I'm going to go ahead and listen to your bowel sounds.
They're empty.
And 4 quadrants. Okay. Now I'm going to go ahead and percuss. Lay back for me. Okay, good. And now I'm going to go ahead and check and let me know if you have any pain on this side. I'm going to let go and let me know if you have any pain on the other side, okay? Any pain there?
No.
Any pain there?
Mm-mm.
Any pain on these sides?
No.
Great, so you don't have appendicitis or any gallbladder tenderness. And then I'm going to go ahead and... Okay, well, that completes my assessment. Do you have any questions?
No.
Okay, great. Have a good day.